already considered the application of the internet and other related technologies. So in our situation now, in our healthcare situation now, even in in nursing education, we're using the application of the internet and the use of the technology. The technology could be the software and the hardware, and the internet is significant when it comes to how we will process information. So nowadays there this shift of the Health Information and Management System Society, or HIMSS, geared towards to improve four aspects: access, efficiency, effectiveness, and quality. If we say access, uh, this is very important whenever the client will have the consultation or will experience admission in the hospital. And most of the doctors and the nurses will definitely ask about the patient's medical history. If pregnant, about obstetrical history, or if the patient will undergo or scheduled for operation, the surgical history or previous hospitalization. But it will take time for the healthcare team to gather the needed information, because it will still undergo the process of interview. Unlike for unlike for the health information or the use of the hospital information system, the hospital can be given a viewing rights to the other healthcare facilities where the patient had been admitted or where the patient undergone the procedure through its basic information, just like the recent diagnostic examination, so that to have a comparative analysis, the condition of the client after the operation, if experienced any complications. So these are very basic information that is very relevant when it comes to decision making. And indeed, the accessibility, even not just only with the doctors, with the nurses, but the healthcare team, may have a major key role. Definitely have a major key role when it comes to the holistic approach of decision on care management. So that's why accessibility is very important. Efficiency, if we talk about efficiency, this talks about the use of resources, or the maximization of the use of resources. And the resources that we're talking about are the manpower. So if the health information and management system will be implemented in a certain institution or in a specific facility, this will need individuals who are competent and skilled enough to process information using the process flow of the access, the storage, the protection of data and information, because we have the accountability when it comes to the client's information, so it must be protected. So other than the manpower is we have the resources. If for example we're trying to consider if the hospital are capable of processing adaptation of the health information and management systems. That's why even when the Department of Health launched this e-health, and one of their direction is to have the electronic medical records in most of the hospitals, the next question or a follow-up question goes with, are these hospitals capable of adapting the process of electronic medical records? So we need definitely computers. Second, we need very strong connectivity. And third, we need to have infrastructure when it comes to the components of the processes involving the health information system or health information and management system. So these are the things that will follow through when it comes to efficiency. And if we consider specifically the upgrading of the systems and adopting the hospital information system, this will definitely consider funding. And that's why there are some situations if the hospital is funded by the local government units, but but the funds are not uh, available, so they may not adopt the health information and management systems platform. So when it comes to the effectiveness, this is definitely the measure of the success of being efficient. If you have the skilled and competent manpower, who are knowledgeable and competent about health information and management systems. The available resources are distributed in all of the departments of the hospital. So your intention is to apply the health information management system from admissions to the emergency room up to the other departments such as central supply, the billing statement, the billing department, or the finance department. So if it leads to equality and high satisfaction rate by the customers or the stakeholders, those are the measures effective uh, eventually and as an indicator that they have met the standards of effectiveness. While when it comes to the quality of clinical, we have discussed before about the clinical informatics. And in clinical informatics, this focus specifically on the individual approach. So that's why if Health Information and Management System Society emphasize that it will meet the quality of the clinical, this will benefit our stakeholders, the clients themselves. So other than the healthcare management, we're considering also that hospitals and other facilities are still business. Okay, are still business in nature. So that's why there are some processes that are related to finance, documentations, records, which is somehow outside with the nursing care management, but still this is interconnected with each other. So that's why the processes, the health information and management system are still incongruent and attuned with all of the processes, because if you will upgrade the health information management system in the individual care management, then this is also connected with the billing, this is also connected with the other departments that is part of the patient's condition while on the hospitalization. And most of the stakeholders of the health information and management systems are those who may benefit are the healthcare organizations, the hospitals, the facilities, practitioners, so the healthcare team, the patients themselves, and the consumers, so our stakeholders, which is directly its purpose is to improve the health status of the patients, which with the health information management systems, this considers po the challenges. Okay. We have the vision of the e-health by 2020, but their vision is focused on the perspective that we are already having the strong internet connectivity in the national level, and almost all of the healthcare institutions can facilitate the information exchange through the use of the platforms. But in reality, this is still a problem because of the many factors to consider. So that's why the challenges in today's health system is the access to healthcare services. So most of the areas that really experiencing who are really experiencing challenges in the health system are those who are in the far-flung areas, in the mountainous areas, wherein these areas are far from the setup here in the National Capital Region, where the accessibility is strong, all the 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 communication sites are available. But the problem is that we cannot implement, we may not implement the health information management system if the areas can't be reached by the needed resources, from the manpower up to the infrastructures that are needed. So usually we start with our healthcare delivery in the primary care, which is the health center. So that's why even the government and the Department of Health are gearing towards to upgrade the resources, but still not all, not 100% of our health centers in the country are already adopting the health information and management system. And another is if these are not in place all over the country, still considered as a challenge is the real-time information for decision making. It's very important because when we consider the real-time information, just like for example, from the Department of Health, if they may not give us a real-time information, it will be a pending decision when it comes to the declaration of the alert level, when it comes to the strong implementation of the minimum public health standards, which is already in place. But when it comes to the specific decision making, if we can access the real-time information, because usually the cases are the ones that are being considered by IATF in decision making. The hospitalization utilization rate is also very important when it comes to the capacity, because this will give us the picture that we can now adopt alert level 1. So that's why we are on the alert level 1, because the vaccination rate are increased. The cases are decreasing, the hospital utilization rate are decreasing. So these are real-time information necessary for decision making, but still a challenge for some of the regions. So that's why we are already in, it was already enacted into law, the Universal Healthcare Act, or the Kalusugang Pangkalahatan, or KP. This has been the flagship program of the Department of Health, Kalusugan Pangkalahatan. Actually, it was already Formula 4+1 as an initial, as a program that are initiated by the Department of Health. This could be more efficient, and it will may lead to more effective implementation if the health management and information system are in place. So let's think of the realization. It's not in place in all areas, but it is a priority need for now because of our limitations. Because nowadays we can now have two options. Unlike before, most of the consultations are done face-to-face on a physical clinic setup, but due to the pandemic, we have already adopted and embraced about teleconsultation through the use of the platforms, through the use of the e-prescriptions, the access of the doctors through the electronic health records or electronic medical records. So these are the things that definitely was embraced by most of us, and we learned from it. That's why we are now getting back to our usual setup, but I think it may not be fully considered yung normal that has been experienced by majority of us before. So let's face it, this is National eHealth Vision that supposedly had been in place by 2020. So the purpose of the eHealth or National eHealth Vision by 2020, but I think it was already now crafted for 2021 onwards. So we may need the 5 years for this to be crafted. But its purpose is to have the widespread. If we say widespread on a national level, it could be also on a global setting or arena. So the eHealth will enable widespread to healthcare services. Example, when the client will be subject for diagnostic examination, now we through our e-commerce, through our use of platforms, there are some diagnostic services that could be done at home already. So the laboratory scientists or the medical technologists will just visit your homes and conduct the diagnostic examination. But how about the results? Do our clients will still proceed to the diagnostic centers? Not anymore, because they can already access to the specific available platforms of the diagnostic center where they can access the results. So the patients at their convenience may not leave their own homes. So these are the healthcare services. Another healthcare services that we could consider is during disaster, which is very important as of our situation now, because the emergency disaster response is very important, so that to prevent casualties. So also to manage the evacuation of those high risk and vulnerable individuals. So if we have a widespread access to information, this could facilitate the response of the team to the affected areas. Second, they could have also the information of the areas where it may have the priority attention when it comes to responses. So hoping this was in place in 2020, but still we are struggling for this to continue and have this established to a higher level of expectations. When it comes to the health information, a widespread access, just like if, for example, as one of the examples that I have is for example, the client who is pregnant will be scheduled for the normal spontaneous vaginal delivery here in the National Capital Region, or specifically in Manila, but she had her pre-consultation, okay, in Mindanao. So it will be a problem on the hospital if, for example, it's an emergency health risk, then they need information when it comes to the immediate management, diagnostic examination, pharmacological management, because they still need to consider if the client has hypersensitivity reaction, if the client has experienced in the previous pregnancy of preeclampsia or eclampsia. So these are the basic information that is very important. That's why even in the even it is advisable if if uh, when you have if where you have started consultation, then it is much better that in the same hospital that you will have your delivery. But the problem is that of if in case-to-case situation that the client transferred her residence, then the access of information is a problem, because if ever the client do not have the documents coming from the hospital, and if that could be grabbed, that could be processed through LBC, but it will take days and time for the hospital to receive, and the situation may need immediate attention. So another is the widespread purpose of having the National eHealth Vision is in particular to secure protection of the share and exchange of patients' information. So that's why here in the Philippines, I know this was one of the topic in your laboratory, wherein it considers the Data Privacy Act to protect the data subjects when it comes to the information. And the exchange of patients' information may not happen only between two persons. It may happen to anyone, or it may process to anyone who may have the access rights in the hospital facility. So I think this is a very important way on how to strengthen security features of the systems adopted by the hospital. So as an impact to this widespread access, it may lead to a more safer quality healthcare, because safety is the highest priority, and more equitable, meaning all may benefit, and responsive. It means that immediately we could attend to the situations as expected. So that's why in the process of data, to process it to information and transform it into knowledge, it will need management process. So you need to plan, to organize, to direct, and evaluate. As similar as to the information as mentioned in the National eHealth Vision, as to plan, manage, and deliver and monitor health services. Because if we could access this information on a proper perspective, we can easily have the care plan management, and have the implementation of intervention immediately to the client, and even monitor the client's status or health condition as well, which is very timely. So at least we could sustain the health for fast recovery. We could consider the health of the clients for fast recovery, and eventually free from the problems with the health condition. So these are the National eHealth Vision. And with the National eHealth Vision, what you're seeing on the right side of the slide is pertaining to the initiatives that have evolved in the implementation of the National eHealth Vision. Actually, it started with the Philippine Health Information Exchange. We are aware of the Freedom of Information Act. This anchored also the Philippine Health Information Exchange. Just like, for example, if the client may need PhilHealth due to his hospitalization, the client may not anymore need to proceed physically in the PhilHealth offices, but he or she can access to information or process inquiries through online, through their official portal. So it can exchange, it can facilitate exchange of information from the clients up to these offices, a real-time information that you may access, so that it will give you idea of the status of your contribution. And this is very important in meeting your needs when it comes to the finances of your health management. So when the Philippine Health Information Exchange starts to implement, there are many platforms that have been introduced. What you're seeing here is the iClinic SIS, the Cheats, the Wireless Access for Health, iHomies, Shine. So these are the platforms that already started in the primary care. Cheats, they have adopted this in Quezon City. iClinic SIS in some of the provinces. iHomies are for the public and government healthcare institutions. Even the Makati Medical Center have already adopted those platforms. And with these platforms that are in place, we can only identify those hospitals that are capable of adopting the Philippine Health Information Exchange through the use of the health data standards and using these platforms, because it is very much important for everyone to be aware that this platform is intended for the Philippine Health Information Exchange. And if we have already these platforms, it can only require data that are unified for everyone to fill out, to translate it into information. So that's why if these hospitals and facilities are capable of facilitating the implementation of the health care information and management systems, wherein the infrastructures are in place, they can fund it, then they could have the electronic medical record certifications. If we will try to compare this into our situation, di ba, sa Department of Health during the time of the start of the the accreditation and recognition of diagnostic centers that can only offer the RT-PCR test, it must be accredited and recognized by the DOH, because their purpose is to gather information, and it is a mandate for them to have an IT capable and enable facility, because of the real-time information that the Department of Health may need. Because we all know, before, during the time in the peak of the pandemic, reports must come out before 4 o'clock. The DOH must have already the updated cases, active cases, recoveries, and even deaths, uh, that will be considered as a reference when it comes to alert level system, and will definitely alert the affected areas or facilities. So before, they do have the electronic medical record certification, meaning if this hospital may have the certification, meaning these hospitals and facilities are capable of managing the health information and management system. It has been their vision that all public health facilities will be considered as in IT, with information technology access, and other than that, all of the services of the hospital, from diagnostic, from admission to billing statements, central supply, and some other departments, will be considered as IT-enabled health services, wherein the client may not anymore proceed to the billing department or the finance department just to check for the updated billing statement. They could just access to their, even in their own mobile phones, or just visit their portal or the website. So actually, in the direction to facilitate the national e-health visions, these are the 1, 2, 3, 4, 5 areas that may benefit supposedly if this national e-health vision has been in place. Just like for the health information. So health information, it anchors the health reports. Kaya that's why we have some problems with the data and the information that we need. If just simply a case. How many nurses, how many registered nurses or nurses do we have here in the Philippines? We can access it through the Professional Regulation Commission. We can access to other agencies. But how about the others who may not have access to those agencies? How they can access the information? So even with the leading cause of deaths, morbidity and mortality rate, leading causes of injury. So these are very important health reports that will be very important for the policies and guidelines. So even with the healthcare activities, for example, we are encountering now mga mobile clinics. So if we are aware of the healthcare activities, and you can have the tracking system application in your mobile phones if the mobile clinic are already in your town. So that's why if you can access to these platforms, you are aware that the mobile clinic is already in operation in your town. So you may now be aware that there are activities that are happening. In the health records, patient may have access the basic information that he may need. Healthcare team may also have the access of information that he may need on a remote setup. Personal record, medication record, his medical histories, examinations, and even procedures that will be scheduled or had been done to the client. Basic information that is comprised with the electronic with the health record. So that's why we have EHR, electronic health records. So even with the healthcare services, pag healthcare services, before we wish to access for the specific drug, but we do not have access of information if we have nearest pharmacy or healthcare institutions that may have stock of the particular drug. During the time of the peak of the pandemic and the COVID-19 infection spread, the spread of COVID-19 infection, who have a drug that is a choice for the management of critical COVID-19 clients. But the relatives do not have the access if they do not know individuals who may have access to the certain agencies and offices. So they may not have the knowledge and awareness where to purchase this drug. So unlike if this national e-health vision will be in place, they could actually know where to access this drug with these pharmacies, or examinations available for diagnostic centers. And even during the time of the pandemic, we have the hard time to have the admissions in most of the hospitals. So that's why there are some hospitals who are posting advisories that we are in full capacity. But if we do have the National e-Health Vision, the Health Information and Management System platforms, we can already access that these hospitals nearest to your home are cannot anymore accommodate your cases because they are on full capacity. So in that way, it could be leading to the objective of a safer, quality care, equitable, and responsive health system. If we will try to go back to the historical perspective of the e-health context setting, actually, if it's 2020, it established the framework way back 2011 pa. So can you imagine that? If we are now 2022, it's almost 10 years in the process, but have not yet met the vision. But on the context, it started actually the context from the MDG, which is now SDG. The SDG is the Sustainable Development Goals. But during the time of the conceptualization of the framework when it comes to the e-health, it started in the Millennium Development Goals. So it expounded into the SDGs until the Philippine Development Plan, or 2011 to 2016, have set the national objectives for health. And it must be supported by the government. So that's why they do have the roadmap and the master plan from 2013 to 16, how the country will be digitalized to have more cell sites in remote areas, because the strategy have already started from 2011 to 2016. But still, we are encountering these challenges in most of the areas in the country. So I hope the government will consider this as a priority agenda. And that's why from the digital strategy, they have in place already the Information System Strategic Plan of 2011 to 2013, until they have ended up with the Philippine e-health Strategic framework and plan from 2013 to 2017. So they're looking forward to this 2, 4, 6, 8, 10, 12 services to be accessed na lang through online. This was pre-pandemic. Can you imagine that? We are gearing towards this pre-pandemic way back 2017 back to 2011. So they are hoping that the Philippine Health Information System will be upgraded in terms of yung mga frontline services. Ano yung mga frontline services? Emergency response sa mga hospitals, emergency response naman in the community. Regulations, meaning individuals can have an access to the updated regulations. Yung health supply chain, I think this is related to the distribution of the supplies to the hospitals. Just like for the vaccination, during the time of the vaccination, this is one of the common terms that you usually encounter, yung health supply chain, on how the vaccines can be transferred from one place to another because it has the requirement when it comes to the temperature. So that's one. Pharmacy services. How many pharmacy do we have in our communities? Are these drugs available? So this could be done na lang sana through web services. It may not have a call na lang sana. The individual independence could be appreciated much sana. So health service delivery, yun nga, there are some home services that can be established. Even the clients may not get out of their homes. Community-based services, so yung health centers natin, you can access if these services are available because not all health centers have the same or have all the DOH-initiated services. Diagnostic services, as what I mentioned, hoping they are gearing towards the kind of the disease registries and surveillance, meaning yung tracking system na recently lang na digitalize. Before it's still manual, yun just the same as similar yun dun sa tracking sa contact tracing before na they will hire a project based individual and they will go house to house to trace specifically those who have been considered as close contact by those identified with confirmed COVID-19 infection. Environmental monitoring, ito sana yung the government can already, or the individual can already identify if the temperature is alarming and may risk your health. Yun sana eh. Health insurance, finance and insurance, ito yung sa PhilHealth that although these are already in place, but hoping it could still upgrade those services. Yung human resources in health, dito we can identify yung pinaka-close and nearest nurse or doctors that can respond to you in your communities. So these are the 12 areas by which applications are gearing towards the web services. Some have already materialized, some are still in progress. So this roadmap has been one of the major topics in the 66th World Health Assembly. And it is not new to us because the 66th World Health Assembly was way back 2011 pa. And that's why, as mentioned, it came out yung Philippines eHealth Strategic Framework and Plan as the result of comprehending what our country needs when it comes to achievement of health goals and how to bridge the gap with those challenges. So actually, the guiding principles that the eHealth use or utilize are yung how we could promote client-centered information or person-centered information, that it will increase independence of the client. That's why meron tayong tinatawag na telehealth, teleconsultation, teleconference, collaboration and partnership with different stakeholders that will involve the clients, the healthcare team, the administrators, users' involvement on how seeing ourselves as beneficiaries to be involved in this process. Various approaches that how the Philippine Health Information Exchange has evolved. Harmonization, meaning how the public and the government institution will harmonize on the objective. But I think during the time that this is implemented, one that is the one or the facilities that have adopted immediately are the mga premier hospitals or private hospitals. So it was not established in the primary care. So paano yon? Paano mag-harmonize yun if in the secondary and tertiary care it was established but the primary care is still a problem? So this has to do with the human resource, with the available manpower, laws and regulation, and the available resources. So these are the guiding principles of how they have come up with this, oh come on sir, with these Philippines e-health components. Okay. What about this, sir? What about the Philippines e-health components? Actually, it is divided into 4. So yung focus po sana ng e-health is yung governance, legislation, policy and compliance, e-health solutions, and standards interoperability. So we have mentioned yung standards interoperability is connected on the information exchange. So let's start with the governance. Pag governance kasi, if you will notice, it will start, it will consider policy, it will consider management, it will consider monitoring, it will consider collaboration, it will consider the client safety as highest level. So that's why the key term in this aspect of leadership, governance, and multi-sector engagement is involving the policy and decision makers, the healthcare providers, so that synchronize yung objectives in all levels, from barangay to local government units to district hospitals to provincial hospitals to the national DOH referral hospital. So yun sana yung ini-expect natin for governance, but still there's still a gap with the situation because there are some facilities that do not have the established. For example, national government has the fund that will cater or that will process the funding for the national level. But eventually, there are some concerns that may encounter these problems on the level of the barangay if it is not supported by the fund by the local government unit. So it may not facilitate the governance. So hoping the e-health system will consider dito yung e-health goals, strategies, and activities at all levels. Next, when we consider the number 2, legislation, policy, and compliance, always take into consideration national policy, legislation about laws, and protocols. These are the common terms that will associate in this area of the e-health components kasi it will support, for example, Data Privacy Act. Yung Data Privacy Act, it will anchor to all processes involving information. So at least it will benefit everyone on this. And this will facilitate the policy makers. The third is the standards and interoperability. If we use the standards and interoperability, pag sinabi natin standards, all of us can definitely connect, in terms of common usage. For example, RX, all of us probably will if seeing this symbol, we can be aware that this is a prescription. This is related to drug. So that's why when it comes to the interoperability, if I have the e-prescription, if I have a paper, electronic, and it has the RX and it has the doctor's signature with the license number, what could be every individual who will see this paper with the RX and with the signature of the doctor, they will definitely identify it as a prescription. So yun yung standards wherein all of us can still connect on that area. So that's why may mga terminologies, common messaging na even through messages, we have not talked through these platforms, the patient can already understand. Because in layman's, we could use it in layman's. For doctors and other healthcare teams, we could use medical terms. We're connected. So that's a standards interoperability. When it comes to the e-health solutions, the only word that you may consider here is the core system. Pag sinabi natin core system, all of the solutions, from applications to the infrastructure that is needed, from connectivity, from the manpower that you need, from the competencies that you need, from the services that you may need, these are the core applications that will really give solutions. Kaya nga siya e-health solutions. So that's why these are the services and applications by which gearing towards sana on a widespread access. So another is infrastructure. pag infrastructure, always take into consideration how it will operationalize. Example, yung capability of the hospital, they have problems with connectivity. But they have the fund to purchase the platform. Will it be useless? The answer is yes. They have purchased the platform, but the hospital is not capable of internet connectivity. So this must connect. This must connect. If the hospital is capable of storing information through this platform, secure the information of the clients. So this is more on the health information exchange that can be operationalized and establish yung protection. Number 6, workforce or the manpower. A hospital who is starting to establish the health informatics or the health information and management system may need the workforce at manpower who are competent to from one person to all of the employees who are working in that hospital so that they are connected on how to facilitate the use of these platforms. Strategy and investment. Pag sinabi natin strategy and investment, funding. How we can sustain. For example, the subscription of platform is every year and you need to renew it. How it could sustain if you don't have the funding because it may end up the subscription. What will happen to the next operation? So pwede magkaroon yun ng gap and it may really affect the operation of the hospital. So this is how to sustain the e-health vision. So funding and the strategic plan in place. So these are just only the phases that the government have established. Can you consider that? It started 2013 and that the phase 3 supposedly 2020. And by the year 2020, we did not expect that it leaded to the pandemic. But supposedly, if this has been in place and we have a strong e-health strategies, it's easy for us to lead to the paradigm shift. So if you have considered this from 2014 to 2020, this has been the evolution or the historical perspective of supposedly in the National e-health vision of 2020, we have supporting researches and innovations already. Although we have it in place, we have already the BITS box, we have already hospital information system that are being used, the iClinic SIS, the CHEATS. These are the platforms that have been introduced, but all of the facilities have these platforms? That's a big question mark. So that's why with the action lines, they have set this, yung 4 areas in the e-health governance, we have the e-health solutions and the human resource. And I think that ends up with my discussion. So these are the perspective or the aspect by which it will help us on how to facilitate the e-health vision here in the country.